The lung-pacer AeroPace system is a temporary, percutaneously placed transvenous, phrenic nerve stimulating device. 6 components comprise the AeroPace system: the catheter, provided in the catheter kit with single-use accessories, the neurostimulation console, the airway sensor cable, the catheter cable, and the handheld controller. The AeroPace catheter is a single-use 8.5 French triple-lumen central venous catheter with a high-pressure injectable distal lumen. The catheter contains 30 electrodes, arranged in 2 arrays. The distal array is intended to deliver stimulation to the right phrenic nerve, and the proximal array is intended to deliver stimulation to the left phrenic nerve. The catheter can be placed via the left subclavian or left jugular vein, using the Seldinger technique. The target placement of the catheter tip is in the right side of the mediastinum in the superior vena cava, above its junction with the right atrium and parallel to the lateral wall of the SVC. Its distal tip is positioned at a level above either the azygos vein or the carina of the trachea, whichever is better visualized. After placement, secure the catheter to prevent dislodgement. Use a secondary clamp to secure the catheter as needed. When the system is in use, the catheter connects to the neurostimulation console by way of the catheter cable. There are 3 options on the console's home screen, 2 of which will be used frequently: catheter insertion and therapy session. The catheter insertion option is used during and immediately upon completion of the initial insertion of the catheter. The therapy session option is used to deliver lung-pacer diaphragm pacing therapy, also referred to as therapy, while the patient is on mechanical ventilation. When the system is in use, the airway sensor connects to the console via the airway sensor cable and provides input regarding the patient's breathing cycle and diaphragm contractions. To prepare the console, plug the airway sensor cable, the catheter cable, and the handheld controller into its front panel. When the system is not in use, these reusable cables can remain plugged into the console, conveniently arranged on its handle, which is designed to help organize them. To use the system, the console must be plugged into a power outlet, as it is not battery powered. The power receptacle on the console is on the underside of the display. To turn the console on, press the black power button located on the right-hand side of the front panel. Once the home screen appears, the console is ready to use. The home screen has 3 options: catheter insertion, therapy session, and settings. Time, date, and language can be modified in settings. The catheter insertion option is used during and immediately upon completion of the catheter insertion procedure. Have an assistant available to operate the neurostimulation console outside of the sterile field during the catheter insertion procedure. The catheter insertion screen has 3 tabs: ECG, placement, and exclusion. The ECG feature displays an intravascular electrogram to be viewed by the clinician to help determine the position of the catheter's tip relative to the right atrium. By comparing the real-time intravascular electrogram on the upper strip with the frozen snapshot in the lower strip, changes in the intravascular electrogram at 2 different positions can be assessed. An inverted P wave may indicate that the catheter has been advanced too far. Placement is used after the catheter insertion procedure to confirm a suitable left-sided position of the catheter. Various buttons, fields, and system prompts help the operator navigate the touchscreen. The notification box displays instructions and system information to further guide the operator in using the console. The Stimulate button is used to deliver stims to the catheter. In auto mapping, the console will determine if the diaphragm has contracted as a result of a delivered stim. The blue Stop button can be pressed at any time to stop the delivery of stims. The progress bar provides a sense of how much time remains before a process will be completed. Finally, end session is selected upon completion of therapy delivery. It can also be selected upon completion of the catheter insertion procedure if therapy will not be delivered at that time. The therapy session option is used while the patient is on mechanical ventilation to provide lung pacer therapy. Mapping proceeds and must be completed before delivering therapy. In mapping, the neurostimulation console selects electrodes from the 30 on the AeroPace catheter to be used in therapy. These electrodes are in close proximity to the left and right phrenic nerves. The minimum amount of energy needed to stimulate the nerves is also determined in mapping. This baseline energy will be increased by the operator, based on patient comfort, in order to optimize therapy for the patient. To perform mapping, press the black power button to turn on the console. Connect the airway sensor cable to the airway sensor, and catheter cable to the catheter. Select therapy session. The right side and left side will both be checked, and both sides will be mapped. Press Stimulate on either the touchscreen or handheld controller. Notice changes on the ventilator waveforms, indicating that the delivered stim resulted in contraction of the diaphragm. Once the Mapping Successful notification is displayed, press Continue to proceed to the Therapy tab. A few parameters need to be entered first before delivering therapy. On the Therapy tab, the stim frequency is set at a default setting of 15 Hz and should not be changed. A skip breath setting of 1 will be appropriate for most patients, but may need to be adjusted for patients with a rapid respiratory rate. Stim duration is the length of time over which a stim is delivered. It should be increased to the maximum of 1.2 seconds if possible, based on the patient's inspiration duration. The patient's inspiration duration should be close to the stim duration. Stims programmed is the number of stims that will be delivered with one press of the Stimulate button. Total stims is a count of the total number of stims already delivered within the therapy session. Right therapy level and left therapy level are the intensities of each stim and can be adjusted with the plus and minus signs. The baseline therapy levels, or stimulation thresholds, were established during mapping and are indicated by the white arrows. Press Stimulate. This will deliver the number of stims programmed, which defaults to 2. Assess the patient and adjust the right side and left side therapy levels based on patient comfort. Press Stimulate. Assess the patient again and adjust both the right side and left side therapy levels. The goal is to optimize therapy by reaching the maximum level possible based on patient comfort. Once the maximum right side and left side therapy levels are established, press Settings. Increase the number of stims up to a maximum of 10. Then press Apply. You are now ready to deliver the remaining amount of stims for that therapy session. Press Stimulate, and always continue to assess the patient for comfort. When 60 is displayed in total stims, press the blue stop button on the touchscreen if necessary, and then press End Session. A summary screen will appear, containing information for your documentation. Press End Session. Next, always disconnect 2 cables. Disconnect the airway sensor cable from the airway sensor in the ventilator airway circuit, and disconnect the catheter cable from the patient's catheter. Press the black power button to turn off the neurostimulation console.